Well, this is a very interesting abstract about lung cancer surgery that it's related with the quality of life. We know that quality of life is very important, not only for the perception of the patient itself, but we have understand that the quality of life itself, it's a very important prognostic factor, not only for overall survival, but also for the completion of many treatments and of course with the success of the strategies that we propose for our cancer patients. There are many publications about the importance of preoperative interventions to improve the overall health of our patients that could be translated in a better preoperative results. This abstract in particular was a retrospective analysis of a prospective database during a year in a cancer center in which the objective was to evaluate the quality of life reported by the patient before and after the surgery, and if it is or not related with the development of complications. They report 225 surgeries for lung cancer, in which very important to mention is that almost 85% of cancer surgeries were minimally invasive, which is very important regardless of the results. And 32% of the patients reported at least one complication. When we look at the quality of life analysis, the majority of the complications presented in the postoperative was associated with pain and discomfort. And this is important because this is one of the most reported complications of thoracic surgery. And to mention, it's important that 50% of the patients reported moderate to higher deficits in the scores for usual activities in the third and fourth clinic visits. That it's about the period in which most of the patients that underwent a lung cancer surgery are recovering for surgery. And this is important because it's the half of the patients, but it's only the half of the patients. I mean, the other half of the patients could be integrated into the usual activities with no discomfort nor disability reported. And this is very important to mention. There is no surprise that in this abstract in particular, the authors report that a lower pre-treatment quality of life score was associated with a major number of postoperative complications. And the most important is that the patient that already had pain and discomfort before the surgery were the patients that were at more risk for complications. And this is very important. I think that the most important message from this abstract is that there is no doubt that pre-treatment quality of life is associated with postoperative complication. And this is very important for us as surgeons, but also as part of a multidisciplinary team, that we look for strategies not only to measure the quality of life of our patients, but to implement strategies to improve the quality of life before of the surgery, because this will be translated in a better outcome after surgery.